Добрый день, дорогие друзья. Сегодня
Ничего не слышу.
дискуссия по подготовке к гипотетической новой волне заболеваний.
Спасибо.
Хватит двух, да?
Да.
Стратегических планов, в том числе тактических решений, в том числе по результатам и уже прошедшей
Что случилось?
скажем, вниз по нисходящей.
I don't hear anything. I'm sorry.
Показывает, что распространение зарубежных стран
There's no translation because of some technical glitch.
реальности жизни и видя, в том числе, что происходит на российском
Нет, я ничего не слышу.
случае, уже штаммы омикрон появились в нашей стране. Сегодня эта дискуссия становится не гипотезой или чем-то таким работающим на перспективу. Сегодня это уже реальные действия, которые мы должны предпринять. Поэтому, в первую очередь, сегодня мы будем говорить о том, что было сделано, что есть на сегодня и что нам предстоит сделать для того, чтобы в пятой волне пройти эту атаку врага с минимальными потерями, с минимальными затратами и, в первую очередь, обеспечить качество здравоохранения и, безусловно, обеспечить здоровье наших граждан. Мы видим, что в течение последних 2 месяцев, конец 2021 и начало 2022 года, темпы заболеваемости снизились, практически количество пациентов вот последние недели сократилось на 30%, адекватно же снизились и показатели смертности населения. И это, казалось бы, нам достаточно хороший прогностический признак, но, тем не менее, видя, что в зарубежных странах, так, например, в Соединенных Штатах Америки, количество заболевших за сутки превышает 1 300 000 человек. Это очень высокие цифры. Поэтому как нам нужно готовиться, что мы должны сделать, это вопрос не риторический. Таким образом, сегодня, готовясь, мы должны в том числе учитывать особенности течения заболевания и особенности распространения. И мы понимаем, что наибольшая нагрузка, конечно же, ляжет на амбулаторный этап медицинской помощи. Каждая медицинская организация должна быть к этому готова. И сегодня, готовясь к этой волне,
Wave, and so getting ready for this wave and taking into account our experience of the latest 21 months, we see that the role of a governor, the role of each region has become key. The great size of the country, the distribution of population, density of population in this or that municipal body, including the communications between and among the regions, all these affects the medical factors of fighting the coronavirus infection. The governors are thus the key players in the battle against the new novel COVID infection. And that's why the president delegated enormous powers to governors in the field of fighting against this new infection. All this is being coordinated both by the federal center and regional centers that have been set up to fight the novel coronavirus infection. And as we are putting together our agenda, we should say that we are now at a critical point. We have here governors who know firsthand what it means to fight against coronavirus infection, and they all have done a huge amount of work in fighting the infection, and we now expect them to say what they have done and what they see necessary to fight against the new stage of this infection. One of the main points is to identify the enemy, to see where the infected people and the sick people are, and the number of tests performed is one of the key factors. I would like to to ask Roman Vladimirovich first, what measures have been done in order to provide the testing of the population? You are in a region where the level of testing is among the highest in the country, and what is the region doing in order to ensure preparedness for the next wave? Thank you very much, Mikhail Albertovich and all esteemed colleagues. Of course, the President has given new arms to the governors in the way of new powers. We are very closely following the recommendations of the Rospotrебnadzor, of the general staff, of all the bodies that coordinate this work. And without this guidance, it would have been difficult for us to work. And those target indicators that you are giving to us, we meet them and we are trying to exceed them. As regards to the level of testing, we understand that the more the sample is, the bigger and the more true to life the picture is. And so in addition to the Rospotrебnadzor laboratories in our region, we have also equipped the venereal and skin diseases institute facilities to work in this field, to perform the testing. And so our skin and venereal diseases centers work around the clock, and we have achieved a very good indicator, and we have almost achieved 360,000 tests performed, and now we decided to allocate additional money from the regional budget in order to provide to make express tests, which the ambulance crews will make when they visit the patient, and not just the patient, but everybody who lives in the same flat, that is his environment. And we have allocated 29 million rubles for this purpose, and this research began to be made already, and thus we are going to achieve the level of 400 tests per 100,000 of population, and be getting ready for the new influx of the population. We first of all pay attention to outpatient clinics and obstetrics and first aid centers, and so we have we have said that we have ordered new personnel to be recruited into all those facilities. We have allocated 30 million rubles to buy medicines for those patients who are going to be treated at home. And within 1 week, we will make a stock for 1 or 2 months of vitamins and medicines that bring down temperature. In view of the events in Europe, we see that the variant is spreading very quickly. The seriousness of disease is perhaps the same or lower than of the previous variants, but it is spreading just like ordinary colds or flu. And so most people will be treated at home. So I would like to thank you for the resources that have been lately allocated to us. We have invested a lot of money into the refurbishment of our clinical hospital and other facilities. We are now working on the reconstruction of the TB medical facility, which will provide additional beds, for example, to perhaps to treat coronavirus patients. So we don't know how the situation will evolve. It's very complex, but we have done a lot to get ready for this. Yes, we did, together with the chairman of the government, we have visited your region, and we decided to support your project, including by allocating money, and I'm glad that you have done it on time and with high quality. And I see that federal resources have been allocated, and you have used them, and you have equipped a third level laboratory. You are among the first regions that have equipped such a laboratory. It is very important. Thank you very much. And of course, the same regulations for the mechanism of overcoming this infection need to create single legal mechanisms for the country without limiting the initiative of the governors. Thank you very much, and I would like to ask the following question to the governor of the Novosibirsk region. It is not a rhetorical question. You have provided very effective use of the resources, including the outpatient and inpatient form of assistance. And what tools did you use in order to provide for such efficiency of using both hospital beds and outpatient facilities? And how are you still providing routine medical assistance and other types of assistance, as our population is very much concerned about this? Well, of course, I'm not an of course, experts will be unable to say which decisions and solutions affected the present situation. I will just make some suppositions. We have drawn a very good we have a lesson from the second wave of the pandemic. It was very difficult for us, and not only because of the absolute figures of cases, but the very quick development of this wave. The peak was achieved within the first weeks, and the medical facilities of Novosibirsk was unable to catch up with all that. And we thought perhaps we cannot affect the absolute figures, but our task is to slow down the speed of spreading of the infection. So we decided to increase testing. And starting on the 1st of January 2021, we test everyone who have any symptoms of colds. Both those who came to an outpatient clinic or those who have called a doctor home. This cuts down the time necessary to get the results, and it also ensures a certain discipline. We can really check if the doctor prescribed a PCR test or something and did all that he was to do. Starting from April last year, we have enlarged the group of contacts, and it is not covered by the obligatory medical insurance tariff, so we provide the necessary resources from the regional budget in order to cover this group. And when we understood that Delta affected children, all the school forms in which at least one COVID patient was discovered, no matter whether it was a child or an adult, everybody was tested in those forms. In order to prevent late hospitalization, we have introduced a monitoring system of monitoring of patients at home by telephone, by operators. We have opened new posts, new channels of communications well established, and we used robots to call patients. It's not a new solution, but I connected with the result that was achieved in order to provide the effectiveness of the work of the first tier work. First, it was done on a voluntary basis, and later we used the resources. We now pay for the taxes used by doctors who are called to visit patients at home. I believe that the result was good. The third wave last year in absolute figures was much bigger than the first and the second. About more than 30% more hospital beds were used. Yes. Almost every third hospital bed in the country was occupied by COVID cases. But we have made it prolonged. Of course, it was not without bad effects, because routine medical assistance was postponed. But there was no bad social effects, really bad social effects. And we have achieved good results in the fourth wave. In our region, the fourth wave started 2 weeks later than in neighboring Siberian regions, and later than in the rest of the country. And it was very much longer. We used only 2/3 of the beds that we used in summer, and it went on for about 2.5 months. So it was not too bad. And it allowed to find the time for maneuver, to provide routine assistance, medical checkups for people. And you have, speaking of providing oxygen, have there been any difficulties? Have any new solutions been found? Have we, for example, employed experts who audited oxygen systems inside medical facilities? We coined a new term, oxygen management, in a number of regions, in southern regions when it was very hot. The centers used oxygen as a means of ventilation. It is a very expensive ventilator. We couldn't afford it, but in Novosibirsk we still have a plant which produces medical oxygen. It is privatized, but it continues to work. So we provided oxygen not only for our region, but also to Altai and to the Kemerovo region. There have been 2 accidents at the plant, and the production was slowed down, and the management, the round-of-clock management, when heads of districts and heads of outpatient departments loaded with their own hands oxygen containers in order to save patients. The plant was refurbished last year, and now we use not so much huge containers. We now use gasificators. We put them into practice even in central district medical facilities. And following the example of other regions, we put them we took them from under the ground and put them overground. It is very important, and the system of decisions taken by the federal assistance regarded support of regions, funding, and creating production facilities to produce oxygen that could be used in the therapeutic departments. So these steps prepare us for the next period. But it was very, we were lucky. We had our own oxygen production facility. We didn't need assistance, but of course providing those oxygen containers was very helpful. You have mentioned calling patients by phone. This is also an element which we see as a key element of the system, an important component which would, in fact, provide earlier diagnostics of cases which need hospitalization, etc. Do you think that the facilities that are now used for telehealth are sufficient, or do we need more? Well, looking back at the third and fourth wave, we can say that it is sufficient, but we understand that in connection with the Omicron variant, the situation might develop differently, and so as from Monday, at the meetings under my presidency, instructions were given to provide new call center facilities, new channels of communications. We have already started talking with colleges and medical universities in order to mobilize dentists and psychologists, and so we need to increase the call center potential by 30 or 40%. We support this area of activities, and we see that those regions that have increased call center potentials provided new information systems, access to the electronic medical history, provide much better attention to the patient. Thank you very much. We'll come back to this. And now I would like to ask your colleague the next question. There is an area of work which is today, during the pandemic, the most fast developing one. These are digital technologies, and we were among the first to create the register of patients, which allows us to see and to offer solutions, which is most important for next stages of fighting the pandemics, which allow us to see how it is all developing in the regions.
We now visualize these figures even at the scale of one single polyclinics, and this did not exist even 2 years ago, and we were the pathbreakers, setting up the register of patients in order to somehow assess the collective or herd immunity. So at the level of the Federation, we may now have the statistics, the analytics, almost online, but actually depends on the regional components. And my next question goes to the governor of Belgorod region. I sincerely believe that Belgorod region is one of the leaders in the country in terms of the implementation of the digital technologies and the solutions which are being adopted in the region allow to take quick decisions, and the patients can much easier get in touch with the system. Can you tell us what other directions you see and how digitalization helped you in such a dire situation? Moreover, that you were sworn in quite recently means that you had to win the election campaign as well. Well, thank you so much, Mr. Murashko, dear colleagues. And really, the year 2020, I spent not in that region, and in 2021, when I headed the region, when I was sworn in, I had some difficulties of a transitional nature. I would agree that Belgorod region pays a lot of attention to digital solutions, which amid the pandemic also brought very good results. A simple example, when the patient comes to the hospital immediately, the recommendations and prescription would be made digitally, and after that, the recommendation would be uploaded into the common digital system, and access to that system, to that database, is provided not at the level of the outpatient level, but if, for instance, a person is administered to the inpatient hospital, or if a person moves to the rural area. Still, we have all the records, so the frequency of attendance, of how often people are seeing the doctor, and the previous recommendations, previous prescriptions. This is accessible to all the doctors. Well, that's very important for our listeners, and I personally witnessed that this system is working, that a person who is discharged from the hospital, in fact, a doctor from the outpatient polyclinics would immediately get a statement from the inpatient institution, and when an outpatient patient actually goes to the hospital, is hospitalized, still all the data about him would be accessible to the treating doctors. Well, this works, for instance, in the framework of the regional database. Everything related to the residents who got a jab, who got vaccinated immediately, we link that to the register that you spoke about in a minute's time, and we don't need anyone to put that data into the system anymore. Starting from August, we run into the following problem. Frankly speaking, in August, from the very beginning, from the very outset, we bet on the high rates of immunization, of vaccination, and summer was a quiet period for us. But once we were hit by the fourth wave of COVID in autumn, still the number of patients grew up, but mostly this increase in the number of patients was due to the unvaccinated patients, and 10 times more often doctors would be summoned a day. In the middle of September, actually, we received about 5,000 calls for a doctor, whereas in the summer this figure was just 500. And we used the hotline number 112, and within 10 days we managed to get full information. We don't have any single call unanswered. We are returning all the calls. First, the doctors were very much afraid of that system. In the admission departments, actually, a nurse would pick up the phone and would not respond, just because they were afraid of not coping with the whole volume of the patients. But once we realized that we can cope with that, we took some very realistic measures in order to fight against COVID. Another step was about digital prescription, and we are also introducing the digital or electronic execution of sick leaves. We are working with the ones who are entitled to the medicine at reduced prices, privileged groups of the people, the vulnerable groups of the people, and the person digitally would submit an application, and the drug, the medicine, would be brought to your home in 24 hours. We have 26,000 people who are entitled to such reduced price medicine, but we cope with that. And apart from that, we're building infectious diseases centers. Oxygen is an issue for us. From the very outset of the year, oxygen was not short. We were not short of oxygen. And thanks to the companies such as Metal Invest, which is operational in our region, and Lipetsk smelter supplied us with free oxygen. But once they had outages or failures, technological failures, we actually suddenly had shortages. And I'd like to thank you for 650 mobile concentrators, and we are getting 50 more from the Ministry of Industry. We are buying 2 more concentrators, and it means that in our centers we are installing both liquid oxygen tanks and the concentrators. We pay a lot of attention to the acquisition of the drugs. We dedicate money from the federal and regional budgets, and I'm grateful to Mr. Murashko when, in a difficult period of time, you seconded the chief physician-in-chief to us, and I saw that the treatment protocols were changed to become more efficient, and judging by the current vaccination rate, we hoped that the burden won't be so heavy. Now we realize that we cannot be relaxed, we cannot be complacent. It's obvious no one experienced anything like that, and I cannot tell the fortune. But 7:30 every morning we start our meeting. I put forward objectives to the heads of the districts. We discuss the plans for the upcoming 24 hours, and I hope that we have become more mobile, more flexible, better organized. We managed to reorganize, to reshape the primary aid system in the biggest cities, and once there used to be just one doctor in the admission department, but now we have 7 doctors at the same time, and a lot of more experienced doctors actually are summoned. We used to have 7 crews working the ambulances. Now we have about 35 such crews. We disentangled different directions. Even one of the COVID polyclinics is transformed into the multi-faceted hospital, just in order to take care of for those who need regular or scheduled treatment. And even special routes were launched in order to make sure that the infected patients are not getting in touch with the non-infected people. And therefore, we managed to bring down the morbidity. Today, we are completing setting up of the very first infectious diseases center, and this center is designed for 80 beds in peaceful time, and about 330 beds may be placed there during the emergency situations. Starovoyt school will build another center, infectious center. This is not just COVID-19 only hospital, and it means that these centers would be capable of addressing other problems, other infectious diseases, just to help the region to develop. There was a shortage of such centers in the region, and we managed to bring together 2 problems into one solution. We took a Bashkortostan case, and we changed 70% of that, although we used that as a template. For instance, we made the corridors wider in order to put more beds in the corridors if the need is. And I hope that in a month's time we'll be able to report to you what we have done. Digital services. This is something very much important for us. My deputy in charge of digital services is one of the strongest in the country, and in future we will bet on more digital services. Well, I watched the newsreels And the anchor spoke about the digital solutions for traffic, and we were speaking about healthcare, but I see the digital transformation of the region now is embracing all the areas of our life. We met in the region, I think, back in June.
Я вот как пример вернувшись
And just
на своем коллеге,
after getting back from that business trip, I talked to my colleagues and I highlighted this good experience when the whole polyclinics and the doctor's office works with totally paperless. Just walking through the offices, starting from the district physician and the labs, I didn't see any paper-backed document. Everything was done digitally. Bear in mind the infectious patients, that's very important because we minimize the risks of contraction through paper documents. In the inpatient and outpatient centers, this is another component of the safety and security of the medical aid. I wanted to inform our viewers that we are bringing one more serious step. Last year, several vertical integrated information systems were designed. One is related to cancer treatment. We are standardizing taking care of the patient, starting from the making a diagnosis and to the curing, the protocols, sampling, chemotherapy data, X-ray, just logical searches of the tissue and other things are being uploaded into that system, and your region is part of that integrated system. We already set up a system on the cardiovascular diseases. Also, starting from that year, the system would be deployed. I heard some feedback from our colleagues who were involved in the development. They always make reference to Belgorod region, so they keep saying that we conferred in Belgorod region. We got advice from them, so it means that Belgorod region is perceived as the pathbreaker, as an expert. And I mean what I'm saying. You speak about medication procurement. I believe that your region would be a pilot test site for the promotion of the digital prescription. Thank you so much for your innovative decisions. I like it very much to work with you, including in terms of the digital transformation. Thank you so much. I appreciate that very much. Thank you for your kind words. Well, you also mentioned the medication procurement. In late 2021, Mr. Mishustin took a decision. At the moment, this is only in its infancy, when the first aid station, which has a license for the providing medical aid, can get registered in the licensing agency and automatically would get a license for the pharmaceutical activity. This is another step to ensure the medication provision. The governor of Novosibirsk region said that this stockpile of medication for a couple of months would matter, but we have to make drugs and medicine affordable and accessible to other people. And now we keep thinking about how to make sure that the drugs and medications are accessible in the areas where there are no first aid stations. How we may support people in terms of drugs in every area. We have to set up equal conditions for every person in the country. We try to find such solutions. Therefore, we would welcome any initiatives proposed by the regions. And now proceeding from digital transformation issues to something else, I'd like to proceed with another thing. Most vulnerable group of people, these are 60+ people. Vaccination of the elderly. This is about saving their lives. People who have a lot of merits, who worked a lot on their lives, the ones who set up lots of families, who brought up children in these families. This is about the right attitude to the elderly people in Ulyanovsk region. This is the region which has a bulk of the population in the age of 60+. I have a question to you, and you are not limited with that question only. When preparing the region for the new wave of COVID-19, it's a very well-known fact that a vaccinated person, even contracting COVID-19, would avoid some grave ramifications or consequences. Omicron situation shows that most of the people in the inpatient centers are the ones who are not vaccinated. Do you have any propositions regarding that? Well, Mr. Murashko, you quite correctly said that Ulyanovsk region, this is the region where the share of people aged 60+ is more than in any other region. This is really true. A lot of young people are moving away from the regions, so they're finishing schools and they're going to Moscow, to St. Petersburg, to other cities. There are many factors contributing to that low pay rate. No leisure places, no entertainment, and we try to make a U-turn to change that situation. But really, people aged 60+ actually account for the better half of the population. But what we plan to do in the region, certainly, these groups of people now are working from home. Certainly we introduced QR codes, and QR codes are still operational. We are informing people about the need for vaccination and booster jabs. And this week, on Friday, I'm going to make a booster myself. And this way I will set an example for the people. And we'll pay close attention to that group of people continuously. On a regular basis, we set up meetings in the region to fight against COVID-19. We learned a lot. We learned how to deploy more beds. The peak days when actually we had more than 600 patients a day. Now this morbidity dropped to 80 patients a day, but now 60% of those who have to be vaccinated are vaccinated, and about 20% of people already recovered from that disease. So we managed to overcome that barrier, that threshold, and we have every reason to assume that there will be no surge in the number of patients. Out of the difficulties we run into, these would be inclusive of shortage of oxygen. There are no producers of oxygen in the region, and we had to arrange for supplies of oxygen from neighboring regions in autumn 2021, I think that the Ministry of Defense and Roscosmos, the space agency, helped you very much. Yes, they did help us, but the volume that they can produce, for instance, the aviation regiment is stationed in the region. They account only for 5% of the oxygen that we need. Well, elsewhere in the country, the defense ministry contributed better. Well, actually, we had to bring oxygen from 1,500 kilometers away. There was even a situation when we had to bring oxygen, 3 tons of oxygen from one hospital to another to avoid this shortage. Actually, the situation was very tense. Now, we set up necessary stockpile of oxygen in terms of drugs and medications. We are fully supplied. Our system now is reacting promptly to the new challenges, and this is very valuable. I'd like to thank the Ministry of Healthcare. When it was a difficult situation, people came from your ministry and they shared their comments, they shared their advice. I'd like to thank you for that. You mentioned oxygen. Now we are speaking about the readiness of the medical institutions and the regions, whether they are prepared for the new wave. Are you more confident? Well, I mentioned some centralized decisions that the federal center supports us a lot. For instance, in Novosibirsk, the availability of oxygen production locally is a very serious factor. Well, we acquired 500 oxygen concentrators, and it helps us to remain confident. Well, the concentrators can be used only in the therapeutical departments. For the other situations, we need medical oxygen. And that's really very necessary. I think that we have altogether to think about that. How to make sure that the region is safe and secure. Any situation should be addressed. And this is for the first time that we provided free medication for the people, sponsored by the federal and regional budgets. I know that Lipetsk region dedicated certain money to provide the patients with such drugs, because otherwise, actually, they will have to pay 5,000 to 6,000 rubles, even when we took all the measures necessary in order to bring the prices down. So in a family, if 2 or 3 family members fall ill, this figure would be quite grave. Well, did this practice give us any result? Whether we brought down the burden placed on the outpatient departments. Even these 6,000 rubles, this is the minimal cost required in order to cure a person. In Ulyanovsk, actually, we have to spend about 32,000 rubles per person in a month's time, and therefore this support is very significant. There were situations, for instance, when we would run out of drugs, medication, and we turned to the ministry, and the ministry provided us with an emergency help, urgent help. And I do believe that we have to follow that practice. It is perceived very well by the people, and that's very important in terms of fighting against COVID. Well, I think that we started talking about the elderly.
Решение, как нам подтолкнуть к принятию решения
How
вакцинации старших.
can we convince people to get vaccinated?
Потому что кто-то может недооценивать,
Well, some people may underestimate the
таить
danger of the new COVID infection, just let me quote several figures that we got. For instance, after a comprehensive checkup
перенесенной коронавирусной инфекции,
following COVID-19, almost 60% of the patients that were examined after recovering from COVID-19 would be registered at a regular checkup with non-infectious, non-contagious diseases. Some of these diseases did exist before COVID-19, but we're speaking about the population. But if we speak about the elderly who already have some chronic diseases such as diabetes and cardiovascular diseases and cancer,
заблуждение, что
such an illusion that a person with some malignant femurs would have a medical exception, that's
злокачественные.
not a good idea. Our foreign colleagues even said that the people with such malignant femurs have to get a booster even before 6 months expire.
Or when a patient gets X-ray therapy or surgical therapy, of course, during that time, vaccination is not allowed. But otherwise, an oncological patient must have a vaccine in order to become safe. Unfortunately, oncological patients suffer from COVID more. How can we win the trust of elderly people? Well, we have not introduced obligatory vaccination for people over 60, but now we are thinking about that. At the peak, we vaccinated about 6,000 people, and now there are New Year holidays. The activity was lower, about 1,500 a day. We understand that it is very necessary to vaccinate this old age category, and we are thinking seriously about forcing them to get vaccinated. And we are now talking to the Rospotrebnadzor bodies. Of course, it is better to help elderly people to take this decision, perhaps without really forcing them. But perhaps we should use the mechanism of the pension funds and social security funds to make a target, to send messages to them quoting some authoritative figures like the medic Smesnikov and others who appear on TV and who talk very nicely about various diseases, and old people are very gullible as regards TV, and so if any of such figure whom they trust tells them in very simple words that they must go and get vaccinated and use the authorities who have the database on the elderly people, then we can make those people go and get vaccinated. Yes, we do have obligatory vaccination for the elderly, but without harsh administrative measures, it does not work. But now we are getting ready to using such harsh measures if there are peak, we will have to force those people get vaccinated using all the administrative resources, and of course it will be a lot. Many people will be unhappy about that because people do not like when they are being forced. But if we do not have any other tool, then we will have to force them. So perhaps it would be good to start a federal campaign using those people whom the elderly trust. But if we look at the rate of the vaccination and the spread of the disease, it is practically identical. As soon as we get more cases, then people run and get vaccinated. But it's too late because now when there are fewer cases, then it is perhaps the best time to get vaccinated, but we are not administrators, we are also politicians. And we feel our social responsibility and the spirit of the society. And it is very important to explain and not to appear too harsh so as not to get people disgruntled. Because if we use too much force in order to preserve people's health, then it might have bad effects. Unfortunately, it is all over the world, not only in Russia. We have not managed to find effective measures of convincing people, especially in the countryside. We saw that a doctor or a paramedic working in the countryside are very authoritative, and very many medical personnel told them that the vaccines were had been too hastily developed, and that there could be could have been bad effects from vaccines, and so people were very much afraid of being vaccinated. And we asked the people in the countryside why they didn't want to get vaccinated, and they said that it was medical personnel who warned them against vaccination. So we must make medical personnel who meet people directly to convince the population to get vaccinated. So we have introduced obligatory vaccination, but on the other hand, we know that our pensioners and other people living in the countryside are usually poor. So we begin to pay 3,000 rubles for people older than 65 when they got vaccinated. So we paid almost 300 million rubles to people, and this was an additional incentive to get vaccinated. And this year we see that the risk zone include pregnant women. So pregnant women, if they get vaccinated, are getting 5,000 rubles, so that they would go and get vaccinated. You know, it is very important to make a future mother immune. People are speaking a lot that this Omicron variant is especially dangerous for children, and so when breastfeeding women are vaccinated, so they protect their newborn babies. Yes, I understood this. When in autumn we went to the Gamaleya Institute, and we took this decision, and we included this in our budget, and we started doing this in our Kursk region. And now I would like to ask Igor Georgievich, your region has one of the highest vaccination figures. What mechanisms did you use? And we have discussed one question, the personnel shortage. Now, we see that in the countries that have already that are already experiencing the Omicron pandemic, they have a lot of workload for medical personnel. Yesterday we have had a meeting with all the departments of health and regional ministries of health in order to work with schools, in order to make people go and get vaccinated. And we all use the terminology, our military terminology, attack, onslaught, mobilization. We are really now in this situation. Thank you. I will start with the personnel shortage. We did have this shortage, and we are having now this shortage. And at the peak, we used all the measures. So we invited all the doctors who are on maternity leave or old age pensioners, doctors, old age pensioners, and other people who with medical education. All the doctors who were not working at the time were all mobilized. Students were mobilized, but it was very difficult for us. And what we have mobilized, we had just enough of them. And if the mobility level will be even higher, then we will have a more difficult situation. And speaking of shortages, we often had difficulties both in private and public pharmacology. We had shortages of medicines. We were lucky to have our state network, Lipetsk Pharmacia, which provided medicines for everybody. And unfortunately, many top players in this field did not act as they should have, and nobody was brought to responsibility. And later we invited all the actors in this field, and we promised them payments from the regional budget, but there was very little enthusiasm. And if there is going to be a doubling of the levels without the Ministry of the Interior, the FSB, and the private medicine, we'll get problems. Either we will have, and we have done that, we mobilized all the medical specialists which were working in other fields, so that they would have did at least something like visiting the sick and making tests, etc., etc. But if the number of those people of cases will be even higher, then it will be even more difficult. And we now then we would like to have a more serious conversation with private medicine, because doctors there do not have those difficulties that doctors in state-run clinics are experiencing. As regards vaccination, we have done a lot of explanatory work. I have called all the leaders of major enterprises, asking them to make their employees go and get vaccinated. And when we saw that not everybody wanted to get vaccinated, then we put up pressure on them. And there are some better districts where people very readily get vaccinated, and there were also districts where people did not were not so happy about vaccination. So we went to those districts and we organized meetings and we saw positive dynamics. We want to continue it, but we do not have too many people who have not yet been ill and who have not been vaccinated. But now we are talking about booster vaccines. But you know, well, people do not believe the threat. We all understand that it will come in 2 weeks. It will reach Moscow in 2 weeks, and in 1 week, 1 week later, it will reach us. And in about 4 weeks, we will see another outbreak. And so we will have to have very harsh administrative, to use very harsh administrative measures, and there might be a very bad shortage of medical personnel. Thank you very much that you have allowed non-medical personnel to make tests. It has made the situation easier for us. But perhaps we should certify certain volunteers who could make express tests, because from the point of view of transportation, well, volunteers, we used volunteers, we used the cars of our administration. Yeah, but yes, we can train some volunteers very quickly, and I think we will use them even more actively, because if there is a large outbreak, then both the number of people and cars and the number of tests to be processed will become much, much bigger. And so at the moment when we will have to work, all the personnel and material be ready. So we hope very much, judging by medical literature, there are not so many people who have to be hospitalized. Most cases of Omicron are rather light, and people do not need to get hospitalized. They stay at home and get. We are not building hospitals. We have our trade unions establishment, which is called Lipetsk Resort. We rent whole floors from them, and we are going to book their premises. We have. We have enough premises. We have bought already oxygen. There are beds. So we would ask them to keep their facility free for March and February, because we feel that we will need all these facilities. So we would like to ask the private medicine. We would like to ask you to give certain tasks to the private medicine and non-specialized personnel. Well, I think that today we have touched upon the most important issues: medicines, personnel, oxygen supplies, informatics. I'm very grateful for you, that it is necessary to organize transportation for medical personnel. It is a very important task. It is very important to be quick when you are transporting patients, and I think we will have to use such technologies when we will have to bring a patient to a medical specialist, and we do not have enough specialists, or perhaps we will have to transport patients to outpatient clinics in order to make better tests. We must find some unusual solutions, think out of the box. And there's another thing which we have mentioned today. This is the work with the population, because we understand that there is the medical aspect and there is the non-medical aspect. We must preserve the economy and normal life of society, but nonetheless we all must ensure safety of the population. So how are we to explain how we can push people towards vaccination? How we can make them go and get vaccinated? It is very important part of the process. You already have certain skills. Even within one region, not all municipalities have the same morbidity rates. And so introduction of certain measures must not always concern all the parts of a region. It can concern those cities or the municipalities which are on fire, so to speak. So thinking locally and acting locally is to be our motto for today. And it is our motto. And I would like to thank everyone who was here with us. Please take care of your health. So if you have not yet vaccinated, go and get vaccinated. And those who have vaccinated more than 6 months ago, or who was ill more than 6 months ago, go and get a booster vaccine and protect yourself in this difficult period for the whole world, including this country. Thank you very much. Thank you, everyone, for participating in this discussion. It has been very useful for me. And I would like to thank for you, for your work during this pandemic period, for your activities. Thank you very much. I wish you all to stay healthy, and we'll continue to work and to fight till we win. Thank you very much for your support.